Get started. A couple of housekeeping things before we get started, just to make sure that this Zoom press conference goes as smoothly as possible. For asking questions, it's easiest if you join from your computer or from an app. We can still do it on phones. It just kind of is a little bit disruptive. So if that's an option, please do so. And then we're going to keep everybody muted throughout the speakers. So when we get to questions, please use the chat function or the raise your hand feature, and we'll unmute you so you can ask a question. And then we also just ask that if you would like a specific speaker to respond to your question, that you direct your question towards them so we don't have everybody speaking over each other. So with that, we're going to introduce Tim Marx, President and CEO of Catholic Charities of St. Paul in Minneapolis. Kick this off. Oh, Tim, you're still muted.
I'm now unmuted. Good morning, everybody. Thank you, Amanda, and thanks to my colleagues across the state for participating in this, and to the media who are taking time when you have so much to cover to listen to the urgent story that we're trying to tell. I am sitting at our Dorothy Day Place in downtown St. Paul, in the shadow of our Capitol and the commercial gateway to St. Paul, where we serve in a recently completed $100+ million complex, 1,000 or more people every day in emergency shelter, in congregate housing, and by providing critical services like healthy meals. And we had a significant housing and homelessness crisis before the COVID crisis. You saw the wilder numbers yesterday, a 10% increase in homelessness statewide, now again at record levels, a 62% increase in unsheltered homelessness. And in the Twin Cities region, where Catholic Charities of St. Paul, Minneapolis provides its services, we've seen the unsheltered homeless population more than triple over these last 4 years. So we were in a housing crisis before COVID-19. And Catholic Charities serves 22,000 people a year, 16,000 of whom we serve in housing and emergency services and shelter. And now that we are in this COVID crisis, the situation is becoming even more dire as people seek services and respite in our shelters and emergency centers, and many of whom are laid off from their work right now, trying to save money so they can stay in their apartments by seeking meals from us. Those who feel vulnerable want to come into shelter, and I think this is a situation that is occurring throughout the state. I do, however, think it's really important to acknowledge and thank the legislature and the Walz administration, how they are stepping up to lead this state on a bipartisan basis with the responses that they have put in place so far. We are so lucky and fortunate to have their leadership. However, we need more support, and we need more resources, and we urgently need them now. In our shelters and emergency centers, I think an analogy is that we are operating field hospitals for the poor. Social distancing, sanitary conditions, and other things that keep people safe from the virus and keep them from spreading the virus simply are very difficult, if not impossible, to make happen in our shelters. With people on bunks on top of each other, on mats very few feet apart, lack of adequate sanitation, although we are doing the best we can and investing heavily in that increased sanitation. Our staff are at risk, and we're seeing some shortages in our own staffing. And you'll hear some stories from my colleagues about things that occurred last night that occur at Catholic Charities as well. We are taking care of vulnerable older adults, some in wheelchairs, who carry their medical devices into the shelters. We are cleaning up after them when they are sick, when they vomit. And this is not a condition that we should have any Minnesotan in, particularly now with this COVID crisis. Catholic Charities itself is now spending at least an additional $250,000 a week, $250,000 a week to make sure our staff can be there with additional support, to buy supplies and extra food. And so we need to do a much better job now to achieve the objective of flattening that curve so that we can beat this virus and move on from it. And our homeless shelters and emergency centers are a ground zero where that must occur. We are asking three things to occur. First, thankfully, a couple of weeks ago, the legislature provided a $200 million package of relief to healthcare providers. What Catholic Charities does and what our colleagues do across the state should be eligible for those funds because, again, we are a field hospital for the poor. We are doing the type of services that occur in long-term care facilities, and we need access to those resources on a prioritized basis along with other healthcare providers. Second, the legislature is meeting this afternoon, and we urgently need them to adopt an aggressive relief package in all sorts of the areas that they are discussing, in housing, in homelessness, additional services, additional sanitation equipment, all of the things that they are considering. We call upon them to continue the bipartisan work that they have started and finish the job this afternoon so that we can get money out the door. Third, we need increased leadership from the Walz administration and others, because we need access to hotels to try to get elderly people out of our shelters and to provide them a safe environment. So to the extent we're providing shelter, it is a much more safe and sanitary environment. We need to think of strategies to get people out of encampments into safe and decent facilities. We need access to arenas and other places where meals can be served in a healthy way with appropriate social distancing. All those type of strategies and the public and private partnerships which can advance them are really important, and that takes the leadership of a governor and cabinet leadership to call us all to action in public and private partnership. Finally, we need our private partners and our private donors, the philanthropic community, to continue to step up as they have in the past, because many of these emergency centers, including ours at Catholic Charities, are primarily funded by the private sector through charitable contributions. We are asking for more public support, and that is critically necessary, but the private sector and our private donors simply can't step aside. We ask you in difficult times, we understand your circumstances, to step up as well. So I appreciate the opportunity to be here with you today. Again, this is a statewide challenge, so I'd like to turn it over now to Rhonda Otterson, who's the Executive Director of the Minnesota Coalition to End Homelessness. I'm not hearing her. Are you hearing her? I'm muted.
All right, here we go. Good morning, everyone. Thanks for gathering with us. My name is Rhonda Otterson. I'm Executive Director of the Minnesota Coalition for the Homeless. I'm working from my home here in Willmar, Minnesota, about 2 hours west of the Twin Cities. MCH is a statewide organization with over 100 member organizations throughout the state. Our mission is to generate policies, community support, and local resources for housing and services to end homelessness in Minnesota. I want to echo what Tim said about our leadership. I am so grateful for the incredible bipartisan leadership that we're seeing right now from the state, in our state, from our governor, our lieutenant governor, Speaker Hortman, Majority Leader Gazelka, and our legislators to put together a funding bill that values the lives of every Minnesotan. Just over 2 weeks ago, the Minnesota Coalition for the Homeless hosted Homeless Day on the Hill, one of the largest gatherings at the Capitol before restrictions on gatherings were put in place. Over 900 advocates visited their legislators that day, and that was a record-breaking event for us. Since then, MCH has rapidly shifted to addressing policy and funding funding needed to stop the spread of COVID-19 among families and individuals experiencing homelessness. As Tim mentioned, Wilder Research just released their latest homeless study research yesterday, and I'd like to highlight a few key statistics. According to their latest study, there are 11,000 children, families, adults, veterans, and senior citizens that were experiencing homelessness across Minnesota on a single night. So the true number is estimated to be about 20,000 people on any given night, and throughout the year, about 50,000 people. And this is all before the current economic impact of COVID-19 on our communities. One of the most startling and concerning statistics in the report as it relates to COVID-19 is that 57% of the homeless adults have a chronic physical health condition, putting them in grave risk if they contract COVID-19. Another deeply troubling issue is the number of people that are unsheltered or living in doubled up situations where their stay is tenuous. This increased, like Tim said, by 62%. In a time when we are supposed to be social distancing to protect our neighbors, and so we don't overwhelm the limited capacity of the healthcare system, we have thousands of people in Minnesota living in spaces that were not designed for social distancing. As a statewide organization, we continually tell the story that yes, homelessness exists across the state. From one of our member organizations in Southwest Minnesota, Angela Larson from United Community Action Agency in Marshall writes about what homelessness looks like in Marshall. People sleeping in a car, living in a storage unit or abandoned building, walking around a 24-hour business to stay warm, camping in cold weather, staying in a shed or garage, sleeping in their place of employment secretly, or being doubled or tripled up. People in this situation often work extremely hard to make sure that no one knows they are homeless. In the Little Falls area, Rose Surma from Oasis of Central Minnesota shares that rural homelessness is a very real, very cruel, but hidden epidemic across our state. The reality of rural homelessness is families and individuals living without shelter, without even the luxury of a waiting list for an emergency shelter in many communities. Rural homelessness is a family with 3 children spending Thanksgiving and Christmas in a Walmart parking lot in their minivan. Rural homelessness is a woman fleeing domestic violence without family or friends that spends the winter sleeping in an abandoned truck in a junkyard on the outskirts of town. Rural homelessness is a patient discharged from the hospital to his vehicle during the winter where his catheter he uses for his medical condition continually freezes. Rural homelessness is a single mom sheltering her children in the only home that will take her, that is filled with drug use, violence, exploitation. All of those stories I shared are real, and all of the circumstances are possible to end. All across Minnesota, shelters and homeless service providers desperately need the resources to provide critical services to save lives during this pandemic. That's why we're asking the legislature to make significant investments in the COVID-19 response bill to ensure the health and safety of children, families, adults, seniors, and veterans during this crisis. First, shelter and housing providers should be eligible providers under the healthcare funding. Like Tim pointed out, they are on the front line of providing services to the most at-risk populations. Emergency shelters and services need resources similar to healthcare providers, skilled nursing facilities, and others who serve and support high-risk, vulnerable populations. Like hospitals and skilled nursing facilities, people experiencing homelessness stay in congregate care settings and spend time in shared spaces while seeking critical services. Second, increase funding for emergency shelters to remain open and for alternative methods to house people during the COVID-19 pandemic. At-risk populations should have the opportunity to be housed in safe settings during this time, which means social distancing. Examples of this would be moving people, elderly folks, or those with compromised immune systems to hotels. Furthermore, the Minnesota Homeless Fund grantees only receive funding for the cold months, and many will close soon without additional resources. And third, support funds for rental assistance to prevent homelessness. This funding is critically important as thousands of Minnesotans have lost their jobs. By increasing funding for programs that assist with past due rent and mortgage payments, we can stabilize individuals and families and prevent homelessness from occurring. In addition to the bill that is anticipated to be passed today, we also can't lose sight of longer-term solutions and investments needed to increase housing stability. That's why MCH and our members will continue to advocate for 3 key legislative priorities. First is a $50 million investment to expand and preserve emergency shelter beds, also known as the Shelter Capital Bill. Second, a $15 million investment to strengthen the Emergency Services Program, which is a program that provides funding for street outreach, shelter staff, and operations. And third, a $500 billion investment in bonds for housing to preserve and build quality homes across the state. Investing in shelter and homes will provide the safety and security that Minnesotans need to thrive. So thank you so much. And now I'm going to pass it off to Steve Horsfield, Executive Director of Simpson Housing.
Thank you, Rhonda, and thank you, Tim, both for your leadership on these important issues. At Simpson Housing Services, as our agency has been determining our responses to this crisis time, we first started listening to the advice that we were getting from public officials, that all of us were getting from public officials about staying at home, which is simply adding insult to injury for folks in our community who are currently experiencing homelessness. And as we took that advice to heart and tried to look at how we could help solve that for some of our guests, what we decided to do was to extend our shelter operation and go to 24/7 shelter operation, so that our guests would not be forced, those who aren't working or didn't have business elsewhere, would not be forced out into the street each morning. So we were able to continue doing that. We were able to extend our hours to accommodate that need. We were also very grateful to be able to work with Hennepin County on moving some of our most vulnerable folks, most medically vulnerable folks, into hotels, and to start to do some of the work that Rhonda and Tim referenced. However, as we look at where we stand now, we are still gravely concerned about the state of affairs. The simple fact of the matter is, I look at the advice that I'm getting, for goodness sake, about how to wash off my groceries when I get home from the store. Our shelter guests are sharing restrooms with 70 of their peers. These are conditions whereby our assumption is that once we do get a case of COVID-19 in the shelter, that it's going to spread like wildfire, probably across shelters, because of that our guests simply don't have, and the resources that we don't have when you are living in a congregate setting. The other thing that we've been hearing from public officials is a severe limitation to what public life looks like. And that is extremely challenging when you're in a situation where much of your life has to be lived in public, because you don't have private doors behind which you can conduct your affairs. And so these are situations that we are very seriously concerned about what this is going to look like for the long term, in terms of the ongoing spread of this virus. We have spent a lot of time talking about in the past, during this legislative section actually, and getting ready for this session, about the number of folks who are housing rent burdened, who are living in a situation where they're spending more than 30-50% and upwards of their monthly income on their housing expenses. And what we've said, and what I've said about these situations, is that these folks are just one crisis away from losing housing. Well, given that we've closed all of the restaurants and all of the retail stores and all the places that we've closed, the crisis is here. In terms of Rhonda's point about rental assistance, rental subsidy, we were frankly hovering just above crisis mode prior to 3 weeks ago. And we are squarely in it at this point in time. So I implore our state leaders to bring more resources and more leadership to the table around these issues, to help Hennepin County be a leader, and to get additional resources and support to be able to move forward with more of what they're doing to help protect our most vulnerable folks, and for us to be able to see that work being done in other counties as well. I appreciate everyone's time this morning. And it is my honor to introduce my esteemed colleague, Lee Stewart, Executive Director at CHUM.
Thanks, Steve, and thanks to my other colleagues, and thank you for all you are listening to this press conference to learn more. CHUM is St. Louis County's largest emergency shelter for people experiencing homelessness. We have We operate 24/7 and always have. We're located in Duluth. Last night we had 100 people at CHUM, 60 in the dorms and 40 in the drop-in center. We also had 35 people who were sleeping at Gloria Dei Lutheran Church as part of our winter warming centers. We can barely maintain safe distance in the dorms. The drop-in center is a challenge and Gloria Dei is a challenge. Over the course of the day, over 100 people will come through the drop-in center. We've taken a particular step to say that only people who are experiencing homelessness can come here. So we've stopped people from just the general public coming. Often we've been in the community living room. We've had to change our practices that way. Internally, we've been focusing on planning and mitigation, enhanced hand washing for several weeks, frequent disinfection of surfaces, lots of education, encouraging physical distance as much as possible. We've been screening people who feel sick or who are coughing for fevers for the last 6 days. We have no fevers yet, but we do have a path to the hospital if we ever get one. We know that this is not enough, but at least we're starting there. We're really grateful for the outstanding leadership from St. Louis County Public Health on helping us create a plan and pathway from a positive test in shelter to isolation and quarantine. Like my colleagues have said, if there's an infection in shelter, it's going to go like wildfire. We'll have a lot of people who have contact and a lot of people very vulnerable for contracting the infection and probably having a worse outcome. We've got the plans are rapidly coming together for that path to isolation and quarantine. They're going to be very, very expensive. We need the support to do that, and St. Louis County needs to be able to get support from the state to be able to help with that. Our concern now is also towards the unsheltered population, which is about probably another 150 living in woods or places where people are not fit for human habitation. We need to make sure that they're included in the pathway for screening, for isolation, for quarantine. As I said, St. Louis County is helping with this. They've had a task force that is at least 4 people. That includes public health, emergency services, contracting, mental health, so that we can have the wraparound services people that need that people will need. I'd say we're barely ready, but we also know that we're not ready for what as large as a problem as this might happen, but we are planning. So we call on an integrated response across systems and levels of government to help meet the special challenges of people without homes in the face of this pandemic. I'd like to turn it over now to Reuben Moore, who's the CEO of Minnesota Community Cares.
Thank you very much. My name is Reuben Moore. I'm the CEO of Minnesota Community Care, and I'm calling in from our St. Paul offices here at the airport. We're the state's largest federally qualified health center, serving 37,000 patients and another 30,000 beneficiaries at our 18 sites here in St. Paul. I want to begin by first extending a heartfelt gratitude for our collaborative partners across the country and across our state. We're so grateful for our federal, state, and county government for stepping in during this crisis. And we're so proud to be a part of a collaborative effort for healthcare for all. I would like to focus on kind of 2 key areas. One is our longstanding relationship with the homeless population as a provider of clinical care and partner in addressing social determinants of health. And second, I'll share our COVID-19 related services and responsiveness to slow the community spread of this global epidemic. Healthcare for the homeless, we're Ramsey County's only healthcare for the homeless provider. Healthcare for the homeless is essential to providing services, whether it be medical, lab, mental health, dental, vision, and a plethora of different services to support our very vulnerable, unsheltered population. We've been doing this for decades. And one of our key partners, of course, is Catholic Charities, who has stepped up in phenomenal ways and continues to step up in phenomenal ways to address this crisis in our state. People experiencing homelessness really do trust us. We recognize they're especially vulnerable during this time, considering their unsheltered social determinants and other needs. We are deeply committed to really protecting them during this COVID-19 global pandemic. There are a variety of factors that really impact the level of instability and stress that comes with being unsheltered. A more limited diet, challenges at sleeping well in a room or on the streets, being around so many people, having inconsistent access to your medications or therapy needs, or ability to contact your healthcare provider. We have a growing unsheltered population who are 55 years or older. who are commonly experiencing comorbidities, co-occurring diseases, and other chronic ailments. We've operated, since 1987, and we've seen a lot of ups and downs and challenges to face this very vulnerable population. And today I'd say this global pandemic is one of the worst. And I think it really will challenge us as a state and all the partners across the state to think of new and creative ways to step in. And I think all of us should really continue to think about how we can lean in for this very vulnerable population. For many years, we've operated these co-located clinics in shelters. And partners like Catholic Charities allow us to see approximately 40 patients a day and serving over 3,000 patients a year. Our newest clinic is right downtown St. Paul, and it's an open access site in Catholic Charities Opportunity Center. That site really is core to our response activities. Our COVID-19 services really stood up in about 72 hours. We thought about this population and we knew instantly that they had critical and immediate needs. And so right away, we leaned in and we recognized that with partners like Catholic Charities, Ramsey County, and the state government, we could get something stood up. But we really need additional resources as we're looking to stand up screening services in our downtown clinic site to provide safe and a welcoming space for our unsheltered neighbors. We also want to stand up quarantine services as well in partnership with our partners. We can't do this without resources. And we've gotten a lot of help so far, but we need a lot more to continue this great work. As we continue to support the unsheltered population from a health needs in order to prevent community spread, I really want to call out and thank again our state, federal, and local partners for really stepping in and aiding us. At this time, I'd like to introduce Monica Nielsen, the director of Elam Church and Strong Tower Parish Shelters.
Good morning. Thank you for your time. I'd like to share what I see through my eyes by telling you a story. I will call it 12 hours in and 12 hours out. You'll have to use your mind's eye to visualize. I operate 2 overnight shelters in Northeast Minneapolis at Elam Church and next door at Strong Tower Parish. One shelters women and one shelters men. At 7 p.m. last night, we opened our doors and we concentrated everyone into one room for dinner. Then women went to a gymnasium and men to a church basement where they spread out on rows of mats on the floor about 2 feet apart. The following identifiers I use are not hypothetical. They're real Minnesotans. Born in Northeast Minneapolis, sleeps next to born in Duluth, who sleeps next to born in Brainerd, who sleeps next to born in Pipestone. Went to high school in Coon Rapids, went to high school in Burnsville, who's next to Bloomington Kennedy, who's next to Edison. Living with diabetes, is next to terrible asthma, is next to had a heart attack Monday. Kurt is an Army Ranger who vomits in his bucket next to his mat on the floor while he goes through chemotherapy. Paul is next to him and he works at a grocery store. Kurt, who's next to him, has terrible pneumonia and is keeping everybody awake because he's coughing all night. He's next to Bill, who does food delivery. We may like to believe that we are siloed, but we are all interconnected. At 7 a.m. this morning, we dispersed everyone to roam the aisles of Target, to roam the skyways, to sit in the IDS Crystal Court, or ride the buses as far as they go for some place to be. Dignified women ask how they can keep their dignity when they're going to the bathroom behind a tree. You may wonder how they keep CDC guidelines for proper hygiene when doing so. I cannot work in isolation, nor can any of my colleagues. We need a coordinated response with each other, with state and federal partners, with the private sector. In my work, I carry two words with me: urgency and hope. We can't concentrate people for 12 hours a day and then disperse them into the public for 12 hours and think that we will have an adequate response to COVID-19. I'm asking for your help in funding so that we may have a place for people to be during the day, that unsheltered people may have a place to be inside, that those who are inside may be spread out into different rooms or different sites so that staff and guests do not infect each other or pass this on to the public or remain susceptible because of their compromised immune systems. I appreciate the help that has come, and I look forward to working with others. With that, I will pass to Olmsted County Commissioner Sheila Kiskaden.
Hi, Sheila Kiskaden, Olmsted County Commissioner, as Monica said. I think you've heard some absolutely compelling stories from the front lines of dealing with people who are unsheltered residents. And Olmsted County and Rochester is not immune from that as well. In fact, I would say we are recently awakened to the broad needs of our unsheltered residents. And so we would not survive as a county in providing services without the kind of partners that you're hearing from, all these not-for-profit organizations that really are the service delivery folks. So let me just tell you very briefly what we've been doing here in Olmsted County and Rochester, and because their stories are much more compelling than mine. We have had our Dorothy Day House close because they couldn't provide adequate distancing between family members or between residents. The women's shelter has closed because they could not provide the same kind of environment that would be needed to protect people. Our new emergency warming shelter, which was supposed to close at the end of April, operated by Catholic Charities of Winona, has closed. We've closed it because we wanted to move those residents were in bunk beds 3 feet apart. And we had the option, thankfully, for the city of Rochester to open up a portion of the Mayo Civic Center to operate as both a day center and an emergency shelter. So we are able to keep the distance for people at that particular location, but that's a short-term solution. We have we've contracted for hotel rooms because you can't have a 75-year-old man with COPD exposed to the coronavirus, and we're fortunate we have lots of hotels here, but it's an expense to the county to lease a number of those beds and try to separate out people who are at highest risk. You know, the warming shelter here, the community warming shelter, had a 94-year-old man who was a regular user of that shelter this winter. The number of people seeking shelter has gone up. We had, I'm told, like 40, it won't sound a lot to use in Duluth and Minneapolis, but for us it's a lot. It's a big increase from a year ago. We had 45 people at the Mayo Civic Center last night. We had another 15 in hotel rooms. We have a former college that's converting to affordable housing, and we're moving families in there. And you just don't think of things like, well, we're housing men and women together. So a woman who could no longer stay at the shelter was suddenly in the same large facility as the person who had abused her. You have to make accommodations. And so it's challenging on many, many levels. And it's easy to think that we know who the homeless among us are, but as you've heard the stories today, we really don't. We see the most visible, perhaps, but this is a serious challenge for the state of Minnesota, an ongoing challenge, and particularly important now that we have to reduce the curve for the pandemic. This population needs to be part of whatever emergency solutions the legislature comes up with, and whatever we can do in our community level. And with that, I think I'll close, and I believe we're going to open to questions from any of the media who are here.
So my name is Matt. I'm with the Coalition for the Homeless. What I'm going to do now is unmute everybody that you heard speak. Speakers, if you see that you're still muted, you may actually have to unmute yourselves, because for some reason it doesn't always work when I'm trying to do it. So, and again, the chat room, probably the easiest way to send questions, but there is a raise your hand feature as well in Zoom, so feel free to do that. So the first question is from Kelly Smith. Besides extra cleanings and asking for more state aid, are there other new efforts that shelters are taking to respond to the coronavirus outbreak? Are there things that homeless shelters are doing in Washington or New York that have worked that can be replicated in Minnesota? So is there one of our speakers that would like to answer that question?
I can do it a little bit. This is Lee Stewart in Duluth. We've been watching the videos and webinars that are coming out of Seattle, King County. And that's one of the reasons that we got an idea to start the screening early in our shelter. So we equipped, at first we didn't, 2 weeks ago, we didn't have any thermometers. And so now we are, anyone who has a cough or who feels bad, we take their temperature, and if they've got a fever over 100, we know that the hospital is ready for them. The hospitals here know that those people are considered a priority for testing. And as I said, we haven't had any. We've tested many, many people, but as of yet, don't have any positive fevers. So that idea of screening and being able to isolate people with symptoms is an important step that we've taken. And then we're also looking to Seattle for the idea about the how the larger structures as an idea for people who are unsheltered to be in a safe type of encampment or a place where they too can get screened and assistance. Very early stages of that right now.
So Tim, I think you're unmuted now. At least you are on my end.
Yes, I think I am now as well. So I can provide some perspective of that. I ran an organization in New York City called Breaking Ground that works with the homeless. And I'm on the board of the National Alliance in Homelessness, and have been following this as much as I can nationally. And all of those who are working with those experiencing homelessness are trying to do the same things, to screen those who are experiencing homeless, taking their temperature, to increase sanitation, to do what they can to social distance. But if you are in shelter, it is simply an oxymoron to have shelter as it exists now and appropriate social distancing. So we're all in the same fix, and there are organizations like ours and those on the phone across the country trying to get more resources and ask our federal government to provide support as well. One particular thing that I think is really important is how we provide access to food. And remember that food for those whom we serve is medicine, just like good shelter is healthcare. And so we're making extra effort to provide a means by which people who are served food can do so in a social distance. We're serving meals, or arranging shifts, having only 2 people at a table in our housing. We're trying to have more meals delivered to a central place, trying to facilitate perhaps meals being delivered to rooms in our congregate housing, doing all of those strategies, as I know my colleagues are, the best they can under the circumstances that we have. But we must change the circumstances with the type of relief and support in hotels and arenas that my colleagues have talked about. Otherwise, the circumstances of spread among those who are experiencing homelessness and the broader community will occur, and we won't flatten that curve as the Walz administration and others are trying to help us do.
Thank you, Tim. We have another question from Heidi with CARE. Could Ruben talk a bit about the new temporary quarantine facility set to open, and if it is going to open Friday now?
Yeah, we're all ready to open and staff Mary Hall in partnership with Catholic Charities. We'll have around-the-clock nursing services. Ramsey County's really stepped in really well to aid us in this effort. So I think that if you come by on Friday, you should be able to see our staff ready. We're still waiting on some additional support in terms of PPE testing equipment from our federal and state partners, and we hope that will arrive soon.
Thank you, Ruben. There's a question from Matthew Geary with Forum News Service. The question is, Governor Walz has already proposed around $12 million for homelessness services in his supplemental budget. How much more do you feel will be needed from the $200 million healthcare fund to meet anticipated needs? Would like to take a...
Well, if we're going to, this is not exactly the answer to that question, but if we were really to end homelessness in St. Louis County, I figure we would need $150 million to create the type of housing that we would need to meet so that we would have very, very few people experiencing homelessness here. That's the ultimate solution. I know the question was asked about kind of this emergency response, but I'd like to keep it in perspective of what's really necessary is a path towards housing for people so that where they're not sleeping in their cars, they're not sleeping on the streets, they're not crowded into shelters. And I'll run some numbers while someone else answers what they think it's going to take beyond that.
Right. This is Tim Marx, and I can speak to the immediate crisis. We have applied for $2.5 million to the first tranche of funding that's available through the Department of Health, because initially our costs are increasing $250,000 a week or $1 million a month. And we know that will only increase as the demand for our services increase and as we are challenged to deliver them in a more COVID responsible way. And so it's hard to predict exactly the amount of resources that are necessary by us and my colleagues throughout the state. That's why we are happy that the legislature has also, provided some additional funds, both in the healthcare fund and in the fund that they're considering adopting today. That is a catch-all. As needs emerge under a responsible process, additional resources will be made available. I think our legislature and the governor, as this unfolds and as we understand what the federal aid will provide, need to be prepared to come back and appropriate additional resources.
Hey, this is Rhonda with the Minnesota Coalition for the Homeless. We are advocating along with the Homes for All Coalition of over 250 members statewide for $50 million in support of emergency shelters and another $100 million in rental assistance in this COVID-19 funding bill because one, we know that shelters are severely stretched right now, and two, that there are going to be a lot of people who have decreased income who are going to need rent or mortgage payment assistance to keep them housed.
And I did some back of the envelope, and if we were to open another shelter just to disperse ourselves, it would cost us about $70,000 a month to do that, and we're figuring about $120,000 a month to operate a 24/7 isolation quarantine.
And Monica, would
rough
you
figures.
I think Monica, you want to go too?
I just want to add that perhaps if anything good can come from this time, It's that we recognize that emergencies cost more than stability, and providing these emergency services very expensively wouldn't have to happen if people had housing. So a year from now, when this has passed and we're talking about housing people, we can actually save money because people maybe don't realize that homelessness is more expensive than housing.
All right. We have a couple more questions here. One from Richard Barr with Threshold to New Life Ministries. We have a number of folks living outdoors and in modest versions of housing that are struggling to find places to get meals. Has anyone thought to go through the handbook of the streets to see who is still providing meals and getting that out somehow?
I can say a couple things to that, Matt. There was some messaging going around from House of Charity yesterday. They've elected to continue with their meal service. They are going to a walk-up service where the food is served in containers outside of their building. I also know that oh goodness, what's the organization that serves at next door to St. Stephen's, Monica?
Loaves and Fishes.
Loaves and Fishes is active as ever and very busy and continuing with their meal service. So a lot of the community providers, the big community providers, at least in the metro, are continuing with their work. I would also just like to mention that we at Simpson, we have had to go to a vendored food service operation, and we've got some terrific community partners that are working alongside of us to make sure that we've got meals that are being catered in to our folks as well. So I think that a lot of people in the community are stepping up and recognizing that this is an area of critical need. And I think someone said it well, that food really is medicine in a time of healthcare concern.
May I add, I do want to say though that homelessness is not just an urban issue, and 1/3 of Minnesota's homeless are in the suburbs, and that's where, for instance, we have moved over 150 of our homeless seniors to Bloomington, and the Loaves and Fishes site in Bloomington has shut down. So people are not near food. In this case, the county, Hennepin County, is doing a good job of trying to get food to the hotel, but I don't want people to think that homelessness is only a Minneapolis-St. Paul issue. We have an equal number of people who are homeless in the suburbs combined.
Thank you. All right, we got another question from Lisa Johnson, KUMD Radio. Do you expect that the attention to people experiencing homelessness now will result in long-term changes, more understanding, more money on an ongoing basis, and more compassion?
Hey, this is Rhonda with the Minnesota Coalition for the Homeless, and I think I'm really positive. I have a positive outlook on what this means in our communities. I think there is a growing awareness about the dire needs across our state. I think the Minnesota Homeless Fund initiative showed that philanthropy is really willing to step up and fund places like where Monica's working with Strong Tower Parish and Elim Church. I know Chum also got those resources, all sorts of organizations. But I think the long-term issue, I really think about it as a two-pronged approach is what MCH is advocating for, and that is one, to invest now in shelter capital and dollars to support shelters until we can build enough housing, which is why we are advocating for $500 million in bonds for housing, because we know that shelters save lives and housing ends homelessness, and that's what we need to do, is make those long-term investments so we have housing that is affordable for everyone across our state.
Anybody else interested in answering that?
I would make one quick comment to say that our experience with the Navigation Center last winter, with the concentration of Native folks that we had at Franklin and Hiawatha and Minneapolis, showed us some things and brought some new attention to the issue in a way that has sustained. And I would hope, if there's one thing, Lisa, to your question, is that people will be paying attention to the fact that we moved across all of our across the state. We'll see what the numbers are ultimately, but just in the Twin Cities, we moved something like 150, I think we're at so far, folks over 60 years old using our shelter system. I hope when this is all said and done, we take a long, hard look at ourselves about what we're doing with our seniors before we discharge those folks back to the street or back to homeless shelters.
This is Tim Marks. With Steve's comment on the Navigation Center, I just want to make sure that people realize that a significant proportion of those who experience homelessness that we see in our shelters and emergency centers are people of color, which only demonstrates the racial divide and the institutional racism that continues to exist in our society. And so I hope that one long-term impact of this is that we realize that we try to solve homelessness because it will start mitigating the impact of that racism. And if we can go upstream, as others have said, and provide housing and give people access to the education that they need so that they can be successful in society and all of those things, that I hope is another long-term impact of this crisis that we don't waste.
Thank you, Tim. So we have another question here. Carolyn Lang from West Central Tribune. What options are available for communities like Wilmer where there are no shelters?
Well, this is my stomping ground. Hi, Carolyn. We currently have a Family Promise Shelter here in Wilmer, and then United Community Action Partnership provides motel vouchers. I believe they have leased motel rooms. I imagine that they are seeing an increase in the needs, which is, I think, really just kind of pivots to the need for additional funding for shelters in our community. Across the state, we have needs, and I think the closest shelter from Wilmer is St. Cloud, which is about 60 miles away, so that is really not going to work for folks. And then those long-term investments in housing.
All right. We have another question from Lisa at KUMD again. Some folks providing supports for vulnerable people in DV shelters or supportive living are having a hard time with city/county offices shutting down and staff people hard to access. What's being done, and is there any way for people on the front lines to cut through the red tape?
This is Tim Marks. I can provide a little bit of insight on that. One of the things that the governor has done and the legislature has done through their actions is to allow the Department of Human Services to waive some of the requirements so that we can get people into the shelters and expedite, their licensing and background checks. And we need to do more of that. And there are ways that we're exploring where you can hire people provisionally, subject to background check. In addition, we need to realize that we're going to need more workers in the system. And we have hospitality and many other workers who are looking for work. I just heard from a colleague today who unfortunately had to furlough several staff, and we're going to try to see whether those staff can be deployed at Catholic Charities. And this is why a statewide coordinated system, perhaps by region, is really critical to create those labor pools so that we can deploy staff and to get that organized with the type of incident command that is being deployed elsewhere so that we can tackle this problem.
Thank you, Tim. So that's the last question we had. So why don't I'm going to pass it back to Amanda.
Yeah, so we'll just wrap it up today unless anybody has any final questions. Thank you all so much for coming and for participating in this virtual press conference. I think it went pretty smoothly, so I appreciate you all rolling with the technology and punches. If anybody has any follow-up questions or needs information, feel free to reach out to Kirsten or Therese, who are listed as media contacts on your press release. And if you don't have that, you can email me. It's amanda.horner@cctwincities.org. Thanks, everyone. Have a great day.
Thank you.